The 3 mandatory tests to refuse after 70, a doctor explains. Hello, my friend, an internal medicine physician and geriatric health specialist. Today, we are embarking on a conversation that is not only critically important, but potentially life-saving. It's also a discussion that is frankly quite controversial, focusing on 3 medical tests that your doctor might insist are mandatory once you reach the age of 70. However, the medical evidence increasingly suggests that for healthy seniors, these tests may actually cause more harm than good. I believe it is high time to bring this vital medical information to light, armed with scientific evidence that the medical establishment may be hesitant to discuss openly, primarily because these tests generate billions in revenue. When we truly understand what the research indicates about screening tests for seniors over 70, we don't just avoid unnecessary procedures. We actively prevent serious complications and can then focus our efforts on interventions that genuinely enhance quality of life and promote longevity. So, welcome back to this space where patient-centered medicine takes precedence over profit-driven protocols, and where evidence-based care replaces the automatic ordering of tests that may, in fact, do more harm than good. Whether you are approaching your 70th birthday, have already passed it, or are actively involved in caring for elderly parents, the information I will share could literally save your life or the life of a loved one. For 28 years in my geriatric medicine practice, I've observed an uncomfortable truth. There are 3 tests that physicians routinely order for patients over 70 under the guise of them being mandatory for health maintenance. Yet, major medical organizations have quietly begun to adjust their recommendations, acknowledging that these tests frequently lead to overdiagnosis, overtreatment, and significant complications in elderly patients who would have otherwise lived longer, healthier lives if they had never undergone these screenings. Let's delve directly into a scenario I witness with disheartening regularity in my practice, a situation that truly breaks my heart because I am acutely aware of the potential harm that is about to unfold. Imagine this: a 73-year-old patient feeling perfectly well, active, and symptom-free approaches their doctor. They explain, "Doctor, I feel great. I'm active. I have no symptoms, but my doctor is insisting I need a colonoscopy, aggressive cancer screening, and stress testing, stating these are mandatory at my age." The patient continues, voicing their apprehension. "But I've heard stories of seniors who experienced complications from these very procedures. I'm confused because I feel fine. Do I really need these tests? Or is there something my doctor isn't disclosing to me about the risks versus benefits at my age?" This is precisely the question that arises from healthy seniors who, with their innate intuition, sense that aggressive testing, when they feel perfectly well, might be misguided. This sentiment is echoed in consultations where families strive to shield their elderly loved ones from unnecessary medical interventions, and reflects a growing awareness that more medical care doesn't always equate to better care, especially for individuals over the age of 70. I urge you to stay with me for this complete medical revelation, because by the end, you will be equipped with information that can protect you from procedures where the medical evidence increasingly points towards more harm than benefit for healthy seniors, potentially adding years of quality life by helping you avoid complications from tests you may never have needed in the first place. All right, let's begin by examining the fundamental medical reality that few physicians are willing to discuss with their elderly patients in an honest and transparent manner. Medical screening tests are, by design, intended for populations where the potential benefits are considered to outweigh the associated risks. However, this crucial calculation shifts dramatically after the age of 70. Your life expectancy, the natural progression rate of diseases, and your body's inherent capacity to tolerate medical procedures all undergo fundamental changes. As with virtually all aspects of geriatric medicine, a nuanced understanding of risks, benefits, and individual circumstances is absolutely paramount. Generic protocols that might be appropriate for a 50-year-old can often prove to be actively harmful when applied to a healthy 75-year-old. Yet, the prevailing practice for many doctors remains the automatic ordering of these tests, often without engaging in honest discussions about whether these interventions will actually contribute to a longer or better quality life. So let's start by establishing the core medical principles. What are the 3 tests that are routinely promoted as mandatory after the age of 70? Why is the medical evidence increasingly questioning their value in healthy seniors? What are the real risks that are frequently minimized or outright ignored by medical professionals? And most importantly, how can you engage in an informed conversation with your doctor to determine if these tests are truly necessary for your specific situation, or if refusing them might actually be the healthier and more beneficial choice? Let's begin with mandatory test number 1, routine colonoscopy screening after the age of 75. This is a test that, unfortunately, accounts for a significant number of serious complications in elderly patients while offering minimal, if any, tangible benefit. The U.S. Preventive Services Task Force, a highly respected authority, now explicitly recommends against routine colonoscopy screening for individuals over 75 who have had normal results from previous screenings. So, why are doctors still pushing this procedure so vigorously? The simple, albeit unfortunate, answer lies in profitability. Each colonoscopy procedure generates an estimated $3,000 to $5,000 in revenue for the medical system. Gastroenterologists, therefore, possess strong financial incentives to continue screening elderly patients, even when the prevailing medical evidence suggests it is no longer appropriate or beneficial. The hidden risks that are often not adequately disclosed to patients are considerable. After the age of 70, your susceptibility to serious complications from a colonoscopy increases dramatically. The risk of bowel perforation, for instance, rises to approximately 1 in 300 procedures for seniors, a stark contrast to the 1 in 1,000 risk for younger individuals, and this often necessitates emergency surgery. Cardiovascular complications stemming from the sedation used during the procedure also escalate significantly. Furthermore, the bowel preparation itself, a necessary step for the colonoscopy, can lead to dangerous dehydration and electrolyte imbalances, which in turn can trigger serious heart problems or even debilitating falls. What does the robust research truly reveal? A landmark study published in JAMA Internal Medicine followed over 50,000 seniors aged 75 and older for a period of 10 years. The findings were striking. Those who continued with routine colonoscopy screening demonstrated no improvement in colon cancer mortality rates when compared to those who ceased screening. However, they exhibited significantly higher rates of hospitalization due to complications arising directly from the procedures themselves. Let's consider the medical reality. Colon cancer is a notoriously slow-growing disease. If you are 75 years old and had a normal colonoscopy at age 65, any polyp that might develop would likely take anywhere from 10 to 15 years to progress into a dangerous form of cancer. Statistically speaking, you are far more likely to succumb to conditions like heart disease, stroke, or other age-related ailments before that slow-growing polyp ever poses a threat to your life. Meanwhile, the colonoscopy procedure itself carries immediate and tangible risks of severe complications. The only exception to this recommendation is if you are experiencing symptoms such as bleeding, significant changes in bowel habits, or unexplained weight loss. In such cases, a diagnostic colonoscopy may indeed be appropriate. However, for routine screening in individuals who feel perfectly well, the evidence increasingly argues against its necessity after the age of 75. Moving on to mandatory test number 2, aggressive prostate cancer screening using PSA, prostate-specific antigen tests after the age of 70. This is perhaps one of the most contentious screening tests in current medical practice, primarily because we now possess definitive evidence that it leads to massive overdiagnosis and overtreatment of cancers that would never have caused a problem for the patient. So why do doctors continue to advocate for it? The PSA test is quick and easy. to administer, and it generates substantial revenue through the subsequent cascade of follow-up procedures, including biopsies, surgeries, and radiation treatments. It has become so ingrained in routine medical practice that many doctors order it automatically, without adequately discussing whether it will actually confer any benefit to the patient. The hidden truth about prostate cancer is profoundly important to understand. A vast majority of men over the age of 70 have some prostate cancer cells present. Autopsy studies consistently reveal that between 60% and 70% of men who died from other causes had prostate cancer that they were entirely unaware of because it was growing so slowly that it never manifested any symptoms. These are cancers that would, in all likelihood, never have threatened their lives. The research findings are compelling. The European randomized study of screening for prostate cancer meticulously followed 162,000 men for a period of 13 years. For men over the age of 70, PSA screening did not demonstrate any reduction in deaths from prostate cancer. However, it did lead to a dramatic increase in the number of biopsies performed, as well as surgeries and radiation treatments, all of which carry serious side effects, including the potential for permanent incontinence and impotence. Here's what often goes unsaid. When you undergo a PSA test after age 70 and it comes back elevated, you will likely face pressure to undergo a prostate biopsy. This biopsy carries a 2% to 3% risk of a life-threatening infection, a risk that is even higher in elderly men. If the biopsy detects cancer, which is quite common given the prevalence of slow-growing prostate cancer in older men, you will then be pressured into treatment even though the cancer would likely have never posed a threat to your remaining lifespan. The consequences of this approach can be devastating. I have personally encountered dozens of healthy, 75-year-old men who felt perfectly well, opted for a PSA test, discovered they had cancer, underwent surgery or radiation, and subsequently ended up with permanent incontinence and sexual dysfunction. All of this was undertaken to treat a cancer that would, in all probability, never have bothered them during their remaining 10 to 15 years of life. The evolving medical consensus reflects this growing concern. Major organizations such as the American Cancer Society, the U.S. Preventive Services Task Force, and the American Urological Association now all recommend against routine PSA screening after the age of 70, unless there is a strong family history of prostate cancer or the presence of concerning symptoms. Finally, let's address the third test that is often presented as mandatory: aggressive cardiac stress testing in asymptomatic seniors. This is a test that physicians frequently order to assess the heart's function even when the patient experiences no chest pain, shortness of breath, or any other cardiac-related symptoms. While it might sound prudent on the surface, for healthy seniors, this practice often initiates a cascade of unnecessary and potentially harmful interventions. So, why do doctors persist in recommending these tests? Stress tests often lead to highly profitable follow-up procedures, including cardiac catheterizations, stent placements, and bypass surgeries, which can generate hundreds of thousands of dollars in revenue. Cardiologists, therefore, have significant financial incentives to identify problems that necessitate these interventions. The hidden dangers associated with stress testing itself are substantial. The test, by its very nature, involves stressing the heart to its maximum capacity, which can, in fact, trigger heart attacks in vulnerable elderly patients. Moreover, false positive results are remarkably common. It is estimated that 40% to 50% of abnormal stress tests in seniors are found to be without any underlying issue when further investigated with cardiac catheterization, leading to unnecessary invasive procedures that carry their own set of real risks. What does the scientific research overwhelmingly indicate? A study published in the Journal of the American Medical Association Cardiology followed over 10,000 seniors who were free of cardiac symptoms. The results showed that those who underwent routine stress testing did not experience better cardiac outcomes compared to those who did not have the test. However, they did experience a significantly higher incidence of complications stemming from the follow-up procedures that were triggered by the abnormal stress test results. This leads to what is often termed the cascade of harm. Here's a typical scenario. A 73-year-old individual who feels perfectly fine undergoes a stress test simply for a routine checkup. The test reveals an abnormality. The patient is then rushed into a cardiac catheterization. During the procedure, a 40% blockage is identified, a blockage that would almost certainly never have caused any problems for the patient. A stent is then placed just to be safe, and the patient is subsequently placed on lifelong blood thinners, significantly increasing their risk of bleeding complications. All of this is initiated because of a screening test that was ultimately not needed. The medical reality is that if you are experiencing symptoms such as chest pain, shortness of breath, or unusual fatigue, then stress testing can indeed be an appropriate diagnostic tool. However, screening healthy, asymptomatic seniors often leads to the overdiagnosis of problems that do not require intervention and unnecessarily exposes you to significant procedural risks. Allow me to illustrate all three of these critical issues with a specific example. A patient named Margaret came to me at the age of 76. She was active, healthy, entirely symptom-free, and felt great. Her previous physician had scheduled her for a colonoscopy, a PSA test for her husband, and a cardiac stress test, all of which were presented as mandatory preventive care. I reviewed the available medical evidence with both Margaret and her husband. We discussed the fact that, at their age, with no underlying symptoms and having had previous normal screenings, these tests were far more likely to identify issues that could lead to risky treatments than to genuinely extend their healthy lifespans. After careful consideration, they made the decision to refuse all three tests. Instead, they chose to focus their energy on interventions that have been proven to enhance healthy longevity after the age of 70. Their regimen included daily walking, strength training twice weekly, adherence to a Mediterranean diet, active social engagement, and diligent management of their blood pressure and cholesterol through appropriate medications. 5 years later, at the age of 81, Margaret remains active, healthy, and is thriving. In stark contrast, three of her friends who did undergo those mandatory tests ended up experiencing serious complications. One was hospitalized for a colonoscopy-induced perforation, another developed permanent incontinence following prostate cancer treatment, and a third was placed on blood thinners after receiving a stent that was ultimately unnecessary. This story is not an isolated incident. I have witnessed this pattern hundreds of times. Healthy seniors who opt to refuse aggressive screening often enjoy longer, healthier lives than those who acquiesce to every test that physicians recommend. The evidence supporting the refusal of these specific tests in healthy seniors is robust and multifaceted. Firstly, a comprehensive analysis published in JAMA Internal Medicine found that for seniors over 75 who were asymptomatic and had normal prior screenings, routine colonoscopy, PSA testing, and cardiac screening offered no improvement in mortality rates but significantly increased the incidence of procedure-related complications. Secondly, the Choosing Wisely campaign, an initiative supported by dozens of leading medical specialty societies, explicitly advises against these particular screening tests in elderly patients who are experiencing no symptoms, labeling them as examples of low-value care that not only wastes valuable resources but also poses harm to patients. Thirdly, international comparisons reveal that countries with less aggressive screening practices for their elderly populations, such as the United Kingdom, often exhibit similar or even superior health outcomes for seniors compared to the United States, where aggressive screening has become the norm. Therefore, when you are approaching or have passed the age of 70 and your doctor suggests any screening test, it is imperative that you ask informed questions. Here are the crucial inquiries you should pose before agreeing to any screening test. Question number 1. Given my age and current health status, what is the actual probability that this test will detect something that will genuinely threaten my life in my remaining years? Physicians rarely offer this vital contextual information. Question number 2. What are the specific risks of complications associated with this test, as well as any potential follow-up procedures it might necessitate? Insist that they provide you with concrete numbers, not vague assurances. Question number 3. If this test does yield an abnormal result, What would we realistically do differently? Would finding something actually lead to a change in my treatment that would demonstrably improve my quality of life or extend my lifespan? In many cases, the answer to this question is a resounding no. And question number 4, what do the major medical organizations currently recommend regarding this specific screening test for individuals in my age group? It's important to note that many doctors may overlook or disregard updated guidelines that now advise against routine screening for certain populations. My medical recommendation for healthy seniors over the age of 70 is to redirect your energy and your medical care focus towards interventions that genuinely promote healthy longevity. This includes regular exercise, maintaining a balanced nutrition, fostering strong social connections, and diligently managing any existing conditions with appropriate medications, rather than engaging in a relentless search for problems through aggressive screening that often creates more harm than it prevents. This approach does not imply ignoring symptoms or refusing all medical care entirely. Rather, it advocates for a more selective, informed approach that prioritizes quality of life over a sheer quantity of medical interventions. The stark reality is that after the age of 70, a less aggressive approach to medical care frequently results in longer, healthier, and more comfortable lives compared to the test everything, treat everything philosophy that has unfortunately become standard practice. Before we conclude, I want to touch upon something of great importance for seniors who are taking proactive control of their health by rightfully refusing unnecessary tests, but who also wish to ensure they are optimally supporting their bodies to maintain the health and vitality that makes such refusals the correct choice. Maintaining optimal health naturally so that you can confidently avoid unnecessary medical interventions requires dedicated support for your body's fundamental systems. This includes robust cardiovascular health, a strong immune function, sustained energy levels, and overall vitality. For these reasons, I often recommend 2 natural support options that can assist seniors in maintaining the excellent health that renders aggressive cardiac testing unnecessary. For seniors seeking gentle support for their cardiovascular system and overall well-being, I highly recommend an organic watermelon extract, which is rich in natural L-citrulline. This compound naturally supports healthy blood pressure, improves circulation, and helps to maintain the cardiovascular health that makes aggressive cardiac testing seem redundant. However, if you are seeking a more comprehensive approach to health optimization, not just cardiovascular support, but also enhanced immune function, improved energy levels, and the overall vitality that allows you to truly thrive without resorting to aggressive medical interventions, then I would like to introduce you to the Senior Vitality Formula. This expertly crafted formula synergistically combines Uricoma longifolia Jack, also known as Tongkat Ali, to support healthy hormone levels crucial for vitality, Icarian, derived from horny goatweed to boost circulation and energy, fenugreek to support metabolic health and sustained energy levels, nettle root for overall wellness and prostate health, and concentrated L-citrulline to ensure optimal cardiovascular function. Together, these ingredients work in harmony to support the robust health that empowers you to confidently refuse unnecessary screening tests, secure in the knowledge that your body is functioning at its peak through natural support rather than through aggressive medical interventions. You will find links to both of these recommended options conveniently located in the pinned comment and the video description below. Take charge of your medical care by having the courage to refuse tests that are more likely to cause harm than to provide benefit. Because true healthy aging after 70 is achieved by supporting your body naturally and actively avoiding the cascade of complications that so often follows overly aggressive screening practices. Remember, for persistent symptoms, always consult with a qualified healthcare professional.